ready to say farewell to San Diego, we're embracing the last moments of this record-breaking ASH annual meeting and exposition, starting with a preview from ASH Secretary Dr. Cynthia Dunbar on the exciting and novel research being presented in the late-breaking abstract session today.
3 of the late-breaking abstracts this year are going to present advances in the drug treatment of hematologic malignancies. Abstract 1 reports results from the multiple myeloma Phase 3 Perseus trial, asking the question of whether adding a 4th drug, in this case the anti-CD38 monoclonal antibody daratumumab, to standard triple therapy with lenalidomide, bortezomib, and dexamethasone actually improves results when they're used during induction and consolidation. Now, I'm not going to give you the punchline here, but I will tell you that, at least in myeloma, this year at the annual meeting, more seems to almost always be better. The second abstract I'll discuss is from the Phase 3 Simpatico trial in mantle cell lymphoma, asking whether the addition of venetoclax to ibrutinib and comparing it to ibrutinib alone improves outcomes in patients with relapsed and refractory disease. And go and hear what that looks like, but it does show benefit. The third abstract, looking at drug treatment of hematologic malignancies, focuses on a new drug for the very high-risk subtype of AML, containing a KMT2A rearrangement. And this fusion protein and its interaction with menin has been shown to be a potent driver for this type of poor-risk leukemia. The small molecule revumenib was designed to inhibit the interaction of menin with the fusion protein. Investigators will report out top-line efficacy and safety data using this new drug in refractory leukemia and meeting primary endpoints for complete and overall responses. The late-breaking abstract session has 3 classical hematology abstracts I want to introduce. One of the most interesting to me personally is number 3, which reports the results from a placebo-controlled trial of pomalidomide in hereditary hemorrhagic telangiectasia. This inherited disorder is the second most common bleeding disorder worldwide, but it's likely often underdiagnosed, and it can have serious morbidity and profound impact on quality of life due to recurrent bleeding episodes from arteriovenous malformations throughout the body. There are no standard or approved drug therapies for this disorder. The investigators report positive results in terms of bleeding scores and specific quality of life parameters. Abstract 4 reports very encouraging Phase 2 results from Clinical Trials Network looking at haploidentical transplantation in patients with severe sickle cell disease. Using an optimized conditioning regimen and post-transplant cyclophosphamide, these U.S. investigators will report very encouraging outcomes in terms of engraftment, survival, and graft versus host disease. Finally, Abstract 6 will report on the discovery of a new inherited marrow failure in cancer predisposition syndrome, involving mutations in the gene encoding ERG, a transcription factor, adding another consideration to the workup of patients with marrow failure and/or familial atypical MDS or AML. So I personally am looking forward to Tuesday morning. We hope to see you there.